Imagine you're sitting on your porch enjoying a morning coffee, and suddenly your smile feels a bit off. One side of your face droops just a little. You think, nah, it'll go away. But what if that little change was your body whispering? An alarm it hopes you'll hear. Today we're going to talk heart about something serious, which is the early signs of a stroke many seniors don't know. Here's why this matters to you as a senior. As we age, our bodies send signals. Sometimes those signals are easy to ignore. Fatigue, odd sensations, slight confusion. But in the case of a stroke, recognizing early signs can make the difference between walking out of the hospital or facing lifelong disability. An health study shows that about 75% of strokes happen in people aged 65 or older. That means many of us, our circle, our friends, neighbors, or even ourselves are at real risk. A stroke happens when blood can't get where it needs to go in the brain. That could be from a clot blocking an artery, ischemic stroke, or a vessel bursting and leaking, hemorrhagic stroke. When brain cells don't get enough oxygen, they begin to die. The faster you act, the more brain you can save. We also have what's called a mini stroke, or TIA, transient ischemic attack. Symptoms might come and go quickly, but it's a serious warning, not something to wait out. Another thing, there's such a thing as a silent stroke. One you might not feel immediately, but it still does damage. But today we focus on signs you can feel or notice before things get worse. I want to walk you through these early signs slowly, so you can sense them in daily life. Face drooping or numbness on one side. When you try to smile, one side sags, or part of your face feels numb. Ask yourself, does my smile look uneven? That oddness is a red flag. Darkness, double vision, or trouble seeing in one or both eyes. Vision might blur, go dark, or one eye might turn off momentarily. It's not just my glasses acting up. Sudden changes deserve attention. Another sign of stroke is weakness or numbness in arm or leg, especially one side. You lift both arms overhead, one drifts downward. Your leg feels dead weight on one side. These aren't just aches or stiffness. They're signals. Trouble speaking or understanding. Words come out slurred, or you can't find the right word. Someone speaks to you, and your mind blanks. Confusion may set in. You know what you want to say but can't. Sudden dizziness, loss of balance, trouble walking. The world seems to shift under you. Your steps stumble, you can't coordinate your legs. These are more than getting old sensations. Severe headache with no clear cause. Not your usual tension headache. Sudden, intense, maybe with nausea. If it comes out of nowhere and feels unlike anything before, don't brush it off. Nausea, fatigue, or a general sense something is off. This is trickier because it feels vague. You might say, I'm just tired, or I feel funny. But if this feeling is sudden and paired with any of the above, pay attention. Let me tell you about a dear friend of mine, Mary. Mary is in her late 70s, spry, loves gardening. One afternoon, she was pruning her flowers when she noticed her left arm felt tingly. She shrugged it off. Probably just a pinched nerve, she told herself. A little later, she tried to talk to her husband, but felt words jumbled in her head. Her speech slurred. She paused, unsure. That's when she called her daughter, who rushed her to the ER. Turns out, Mary had experienced a transient ischemic attack, which is a mini-stroke. Because she acted, doctors intervened early, and she recovered. She later told me, I kept telling myself I was overreacting, but my gut told me this is not normal. That gut whisper saved part of her brain. Here are what to do if you notice any of these aforementioned signs. I want you to hear this clearly. Don't wait. Don't hope it passes. Call emergency services immediately. If you see one or more of these signs, face droop, arm weakness, speech trouble, call 911. The faster medical care begins, the better your outcome. Write down the time when symptoms first appeared. That clue may guide treatments later on. I know this can feel heavy to you as seniors, but here's what I want you to carry away. You can learn to listen to your body more deeply. You can act early and change the outcome. You are not helpless. These signs are not your aging catching up. They're signals screaming for attention. If you've ever felt anything strange like this, maybe small twitches, slight numbness, confusion, share in the comments if you're comfortable so others can learn from you. Please like this video so fellow seniors can come across it, and subscribe to join our community of health-aware friends. And here's something for you. Have you ever experienced one of these early signs? Even briefly and ignored it? If so, what was it? I'd like to hear your story down below. Take care, be well, and may you enjoy many more days with clarity, health and peace.